Welcome to video lecture number 5 for chapter 15. In this lecture, we are going to cover hair and nail disorders as well as pharmaceuticals that are used for skin disorders. Before we get into any hair and nail disorders, let's first talk about the pigment that is found in our skin, hair, and nails. So to start, the pigment melanin is found in our skin. Remember, melanin is a dark pigment that, based on how much you have in your skin cells, will determine your skin color. The more melanin you have, the darker your skin tone will be. Well, for your hair, there are two types of melanin that determine the hair color you have. They are eumelanin and pheomelanin. Eumelanin is the dark form of melanin and pheomelanin is the lighter form. So depending on the mixture of these two forms, it's going to determine the color of your hair. The more eumelanin you have, the darker your hair is going to be, and the more pheomelanin you have, the lighter your hair will be. Medium colored hairs, like red and light browns like mine, usually have a pretty equal mixture of eumelanin and pheomelanin. And then a disorder that comes from this, if your body completely lacks melanin, both your skin and hair has absolutely none of that dark pigment, that is called albinism. The only disorder we're going to talk about with the hair is alopecia. This is a condition that causes your hair to thin and fall out in small patches. This happens because the hair follicles shrink and produce thin, wispy hairs instead of thick hair. This usually happens naturally with your age. As you age, either females, our hair thins, or males, you go bald, and it's also based on your genetics, but it can also be caused by various medications that you might be taking. So that is alopecia. We're going to now move on to disorders of the nails. The first one is called onychomycosis. Onychomycosis is a nail disorder that's caused by a fungal infection, so it's a very general term. Actually, about 50% of all nail disorders are classified as onychomycosis. These conditions begin in nails that are constantly exposed to moisture and warmth. So if you wear warm shoes and don't take care of your foot hygiene, or if you are a dishwasher at a restaurant, it can happen to your fingernails. It can happen under artificial fingernails. And also, if you go and get a pedicure and the pedicure bowl is not properly sanitized, it can cause onychomycosis. The fungus usually grows underneath the nail, and it leads to a really brittle, cracked nail like you see in the picture. And then the nail actually starts to separate from the underlying nail bed. Paronychia is a bacterial infection of the base of the nail. Paronychia is a bacterial infection that happens at the base of the nail. So what happens is the nail fold and the cuticle become swollen. You usually see some redness, and you get this painful formation of pus underneath the nail that can actually escape at the side of the nail. A lot of people see this in the nail of their big toe, which can grow into the skin at the side of the nail, particularly if it's pressured by tight, narrow shoes. And then infection can get underneath this ingrown toenail, which causes paronychia. Nails are usually really good at reflecting systemic illness. So I'm going to go through 3 different things that your nails can tell you. So the first one, if you have anemia, usually the nail bed is pale and the nails can become spoon-shaped like you see in this top picture. So you see that semicircle, that pale semicircle at the base of the nail. That is what you're looking for. If you have that, you might have anemia. And then you see how the middle of the nail kind of dips down into a spoon shape. That is also a predictor that you might have anemia. In conditions that produce chronic hypoxia, so that's the absence of oxygen, your fingers and toes and the nails can become clubbed-like you see in that middle picture, and it doesn't look real, but it is completely real. The nails basically are the opposite of the anemia nails. They bulge at the top. And then if you have a severe illness like malnutrition or something else, it can produce horizontal white lines in your nails like you see in that bottom picture. So checking your nails to make sure that they look normal can actually help you figure out if you have an underlying disease. And the last part of this video and this chapter, I'm going to talk about pharmacology for skin-related diseases and disorders because there's a ton of them. I'm just going to go over some of the major classifications of drugs and ointments. So the first one is antipruritics. Those are anti-itching substances. Antibacterials are going to eliminate bacteria. Antifungals are going to eliminate fungi. Parasiticides are going to kill parasites that are on your skin. So this is something you might use to get rid of lice if you have an infestation of lice. Keratolytics are ointments that peel the stratum corneum away from the other epidermal layers. So salicylic acid is an example, which is used to remove warts. Anesthetics relieve pain and itching. And the last one is retinoids, which are used to treat acne. The only one you need to know on this list is antipruritics. And that is going to be it for video lecture number 5.